Hey guys, it's Dr. Mike, and I'm here today to talk about something that's often difficult for men to talk about: erectile dysfunction, or ED. It's more common than you might think, and it affects men of all ages. And trust me, we understand that it can be a really sensitive topic. That's why we're creating a safe space here for you to learn and understand ED. Throughout this video, we're going to explore the causes of ED. And there can be a lot of different factors at play. We'll cover everything from physical conditions to lifestyle choices and even the psychological side of things, because we want you to understand that ED is often a sign of an underlying issue and not something to be ashamed of. We'll also discuss the symptoms of ED and, most importantly, the steps you can take to address it. Remember, there's absolutely no shame in seeking help, and taking control of your health is a sign of strength. So let's get started and break down ED together. When we talk about the physical causes of ED, it's important to understand that your circulatory system and your, manhood are very closely linked. One of the most common culprits behind ED is actually cardiovascular disease. Think of it this way: if your blood vessels are damaged or narrowed due to conditions like high cholesterol, high blood pressure, or diabetes, it can restrict blood flow, and that includes blood flow to your penis. This can make it difficult to achieve or maintain an erection. Now, ED can also be a side effect of certain medications. These include some antidepressants, blood pressure medications, and even drugs used to treat prostate cancer. It's important to be mindful of this and to speak with your doctor if you notice any changes after starting a new medication. Other physical factors that can contribute to ED include hormonal imbalances, specifically low testosterone, and we also have to consider conditions that directly affect the penis, such as Peyronie's disease, which causes a curvature of the penis, making erections painful or difficult. And lastly, let's not forget about conditions that affect the nervous system, such as multiple sclerosis or nerve damage from surgery or injury. These can interfere with the nerve signals necessary for achieving an erection. Now let's dive into the psychological aspect of ED, because believe it or not, your mental well-being plays a significant role in sexual function. Stress, anxiety, and depression can take a toll on your libido and your ability to get an erection. When you're stressed out, your body produces hormones like cortisol, which can actually constrict blood vessels and decrease blood flow to the penis. And guys, I know life can get really stressful, so finding healthy coping mechanisms for stress is crucial. Relationship problems can also be a major source of anxiety and stress, leading to performance anxiety in the bedroom. This fear of not being able to perform can create a vicious cycle, making it even harder to achieve an erection. It's important to remember that communication is key in any relationship, and talking to your partner about what you're going through can make a world of difference. So we've talked about physical and psychological causes, but we also need to address the elephant in the room: lifestyle choices. Certain lifestyle factors can significantly impact your sexual health. Smoking, for example, damages your blood vessels, restricting blood flow throughout your body, including to the penis. Excessive alcohol consumption can also contribute to ED. While a drink or two might help you relax, overdoing it can actually depress your central nervous system, making it difficult to achieve an erection. We also can't forget about the importance of physical activity. A sedentary lifestyle increases your risk of developing cardiovascular disease and other health problems that can lead to ED. And last but not least, let's talk about diet. A diet high in processed foods, unhealthy fats, and sugar can contribute to weight gain, high cholesterol, and diabetes, all of which are risk factors for ED. Now that we've covered the various causes of ED, let's discuss the signs and symptoms, so you can better understand what to look out for. The most common symptom is, of course, difficulty achieving an erection. You might find that you're unable to get an erection at all, or that it takes longer than usual. Another common sign is difficulty maintaining an erection during sexual activity. This can be incredibly frustrating for both you and your partner. You might also experience a reduced interest in sex or a lower libido. It's important to remember that these symptoms can be intermittent. You might experience them sometimes and not others. But if you're noticing a persistent pattern, it's crucial to seek medical advice. ED can be an early warning sign of other underlying health conditions, so ignoring it could have negative consequences for your overall health. Remember guys, we're talking about your health here, and that should always be a top priority. The good news is that there are steps you can take to manage and even improve ED. First and foremost, if you're experiencing symptoms, it is crucial to consult with a healthcare professional. They can help determine the underlying cause of your ED and recommend the most appropriate treatment options. Now, these options may include lifestyle modifications, such as quitting smoking, reducing alcohol consumption, eating a healthier diet, and incorporating regular exercise into your routine. In some cases, medications like Viagra, Cialis, or Levitra might be prescribed to help achieve and maintain erections. However, it's essential to discuss these medications with your doctor to ensure they're safe for you. Psychological counseling can also be incredibly beneficial, especially if stress, anxiety, or relationship problems are contributing to your ED. Therapy can provide you with coping mechanisms and help you address any underlying emotional issues. Alternative therapies such as acupuncture or herbal supplements have also shown some promise in treating ED, but more research is needed. And remember, it's essential to consult with a healthcare professional before trying any alternative treatments. We've covered a lot of ground today, but the key takeaway is that ED is a common condition that affects millions of men. It's often a symptom of an underlying health issue and not something to be ashamed of. If you or someone you know is experiencing symptoms of ED, it's so important to consult with a healthcare provider for proper diagnosis and treatment. Remember, ED can be a sign of other health issues, so don't hesitate to seek help. There are many effective treatment options available, and addressing ED can significantly improve your quality of life. Thanks for joining me today, and remember, your health matters. Take care of yourselves and each other.